Assalamu alaikum wa rahmatullahi wa barakatuhu. I'm Ms. Ulfat Amin, PG Pediatric Nursing, Diploma in Nursing Administration. Today, in this video, I will discuss nursing theories. These nursing theories will be discussed in inshallah in different videos, and this is the part one of this video. First of all, introduction. If we look at this nursing theory, why we are supposed to study this theory? See, whatever the care nurses are giving to the clients at a present moment, that is the client oriented care, or we can say providing client oriented nursing care is goal of every single nurse. Why? In order to address the individual and family health needs of clients, this theory based nursing practice is important for designing and implementing nursing interventions. Initially, you people might find nursing theory difficult to understand or difficult to apply, but with the increase in knowledge about these theories, you will find this theory will help you to describe, to explain, to predict, and to prescribe the nursing care measures, or whatever the nursing interventions we are giving all this as per this nursing theories. For example, if we talk about the Henderson's need theory, that theory helps us or helps the nurses to identify the individual abilities, or we can say every single individual's abilities, and to meet his needs with or without assistance. So this word theory has been derived from Greek word which means to speculate, or we can say to see the things. This nursing theory is a set of related statements that describe or explain the phenomena in a systemic way or in a particular way. Theory in nursing. Nursing theory provides a perspective from which to define the what of the nursing, what means the care of the nursing, to describe who of the nursing, or we can say who means who is the client, and when the nursing is needed, and to identify boundaries and goals of nursing therapeutic activities. Nursing theory is a conceptualization of some aspects of reality that may be invented or discovered that pertains to nursing. The conceptualization is articulated for the purpose of describing, explaining, predicting, or prescribing the nursing interventions, or prescribing the nursing care, whatever the care nurses are giving. Components. If we talk about this theory has the following components like concepts, definitions, models, and are based on assumptions and propositions. We will discuss them one by one. For example, if we talk about the concept, what is a concept? Concepts are the vehicles of thoughts, or we can say an idea that gives more meaning to our perceptions. A concept consists us in formulating a mental image about an object or about a situation. For example, if we say thermometer, if we say bad, or pain or anger, so this gives us a concept. What is thermometer? It's a device which measures the temperature. Pain, or she's angry, she's in pain, so it gives us a concept of the something, some object or some situation. Or these concepts help us to name the things and occurrence in the world around us, like when we talk about see, if we hear the word chair, a mental image that probably come to mind is an item of furniture that is used to sit, word chair could also represent a leader of a committee, like we say he, chairperson, or head of a corporation. So it depends on the context in which this concept is used. If we talk about the healthcare settings, the different concepts that we frequently get encountered with are like independence, means patient is independent now. He or she is able to fulfill his or her daily needs now. Yeah, caring, that very nurse is caring. So these are the concepts. Now if we talk about these concepts, they are of three types: empirical concepts, inferential concepts, and abstract concepts. As far as empirical concepts are concerned, they are observed in real world. For example, if I talk about the patient, bed, bedding, thermometer, or some other equipment, that is something real. And inferential concepts are they are those concepts that are observed indirectly, or the things that are inferred from some real situation. For example, if we talk about the pain, we can't feel the pain of a patient, but we can measure it by using different pain scales. And next is the abstract concept. That is the theoretical way of looking at things, or we can say something that exists in imagination, or that is this abstract concept is felt by different individuals differently. For example, if we talk about the peace of mind is something different for me, it is something different for you, it is something different for some other person. It can't be seen, it can't be measured. Next is the proposition. A proposition is a statement that proposes a relationship between the concepts. If we see now what is the relationship between these concepts, that is called the proposition, or we can say these are the statements that explain the relationship between the concepts. This explains what is the relationship between the concepts. It represents that the theorist is particular, whosoever is the theorist who has developed the theory, it represents that theorist's particular view of which concepts fit together, and in most theories establishes how concepts affect each other. Now the phenomenon. Phenomena is an idea or response about an event, about a situation or a process or a group of events or a group of situation. It is simply an idea, or we can say a response. It may be permanent, it may be temporary. For example, caring, it may be temporary, it may be permanent. Care may be good, care may be bad. Self care and patient's response to the stress. For example, for a patient, stressor perceived by the patient, or stressor perceived by some caregiver, that is the phenomenon. Now the definition. The definitions within a theory communicate the general meaning of the concepts. What is the meaning of the concepts that we are using in the theory? These definitions describe the activity necessary to measure the concepts within a theory, or we can say how I define the things in my theory. For example, if we talk about the Newman's theory, a stressor is any stimuli that can produce tension and can cause instability within a system. Now the assumptions are taken for granted statements that explain the nature of the concepts, definitions, purpose, relationship, and structure of a theory. Or we can say assumption is something that we assume. For example, some assumption, for example, stressor, attack feasible line of defense followed by normal line of defense. So we can here we say that we assume that the stressor first attacks the feasible line, and then the normal line of the defense. Yeah, we can say cancer, sorry, smoking causes lung cancer. This is also an assumption, something that is to be assumed. Now the meta paradigm of the nursing theory. Meta paradigm comes from the Greek prefix meta, which means more comprehensive, and paradigm means a philosophical or theoretical framework of a discipline upon which all theories, laws, and generalizations are formulated. This paradigm of nursing includes four concepts: the person, health, environment, and nursing. First one is the person. Who is the person? Person is the recipient of the nursing care, including physical needs, spiritual needs, psychological needs, mental needs, and socio-cultural needs. And the person may include as a patient, as a group, as a family, and as a community. Now the health is the it refers to the degree of wellness or illness experienced by the person, or we can say health has different meanings for different person, for different clinical settings, and different meaning for different healthcare professions. It is a dynamic and continuously changing process. So as a nurse, you face the challenges to provide the best possible care based on the patient's level of health and healthcare needs at the time of the healthcare delivery. Now the environment. If we talk about the environment, it can be divided into the internal as well as external environment. Internal environment is the environment, or we can say individual's inner condition like body temperature, blood pressure, pulse, or we can say heart rate, etc. And the external environment is like the external conditions like the climate, or we can say the atmosphere or the temperature in the environment, etc. Now the nursing refers caring the ill person, or we can say ill client, and help to achieve their health for environment. For example, see, nursing is actually the diagnosis and treatment of human responses to actual or potential health problems. If we see, the scope of nursing is really very broad. For example, a nurse does not medically diagnose the patient's health condition, for example as heart failure or as diabetic. However, she assesses the patient's response to the disease or his activity intolerance as a result of the disease, and develop the nursing diagnosis like fatigue related to disease condition, activity intolerance related to disease condition, for example ineffective coping related to the injury, ineffective coping related to the disease. So this was all about this part first of the nursing theories. Inshallah, see you soon with the next part of this video. Allah Hafiz.